Hello everyone, it's me Dr. Ayaz Ahmed, working as an aesthetic dermatologist. So today I have selected another important topic of dermatology. The name of topic is Porphyria cutanea tarda. Hopefully you will learn and subscribe my YouTube channel. Porphyria cutanea tarda, it's actually a disorder of porphyria metabolism. By definition, it is the commonest of all porphyrias, characterized by skin fragility and blistering of exposed part of skin. It is acquired disease associated with liver disease and it does not cause any acute attack. Introduction, epidemiology and pathophysiology. Urod enzyme deficiency lead to accumulation of uroporphyrin and other carboxylated porphyrin compound. 75% of cases of porphyria are due to type 1 or in other words you can say suprodic, while 25% of cases are type 2 familial form of disease. Urod enzyme is deactivated by uroporphyromethane, competitive inhibitor of urod enzyme formed by oxidation of uroporphyrinogen. Inhibitor is generated by the liver by reactive oxygen species in the presence of iron. Clinical features. Clinical features are fragility of skin, especially of light exposed part of our body, for example, face, neck, ear, nose, and hand, and upper part of forearms. There is also painful blister formation, erosion and hypertrichosis, hypopigmentation and hyperpigmentation, and onycholysis. This picture describes the scenario of Porphyria cutanea tarda. You can see there are lots of multiple blistering lesion with some erosion. These blisters are actually painful and located on exposed part of hand. Moreover, you can also see areas of hypo and hyperpigmentation in exposed part of hand. Onycholysis in nails is also notable here in this case of Porphyria cutanea tarda. Differential diagnosis. Differential diagnoses are variegate porphyria, drug-induced pseudoporphyria, renal pseudoporphyria, hereditary coproporphyria, late onset of Gunther disease, and mild hereditary erythropoietic protoporphyria. So these are all differentials of Porphyria cutanea tarda. Etiology of Porphyria cutanea tarda. So most of the porphyria, especially Porphyria cutanea tarda, it is caused by the excessive accumulation of iron in our body. More than 60% of patients of Porphyria cutanea tarda are due to excessive iron in our body. This excessive iron leads to hemochromatosis. Number second etiological factor is the hepatitis C infection in 70 to 90% of people. Alcohol is also responsible in its etiology. About 30 and 90% of patients consume 40 gram of alcohol regular basis. So another important etiological factor is the estrogen in female, hemodialysis, HIV infection, non-insulin dependent diabetes mellitus, systemic lupus erythematosus, dermatomyositis, hepatitis A and B infection, and hematological malignancy. All these etiological factors leads to Porphyria cutanea tarda-like symptom. Liver disease in Porphyria cutanea tarda. Porphyria cutanea tarda is actually a disease of liver. In most of the cases, liver is damaged. Liver biopsy shows iron fatty change, intracellular porphyrin crystals, lobulated necrosis, and inflamed fibrotic portal tract, and cirrhosis in 15% of cases. Hepatocellular carcinoma is the major malignancy related with the Porphyria cutanea tarda. Now let's come to management. So as you know, this is a disease which is characterized by blistering and erosion on exposed part of the body. So photo protection is mandatory. Photo protection is usually done by sunscreen which contain zinc oxide, titanium oxide and iron oxide, and other filter film for car, home window, wearing of gloves, hats and cloth. Elimination of risk factor, for example, stop estrogen therapy and stop alcohol consumption, and give treatment of hepatitis C infection with interferon. So these are all general uh, step in the management of Porphyria cutanea tarda. Now let's come to specific treatment. Specific treatment of Porphyria cutanea tarda is low dose of anti-malarial drugs, venous section, desferozamine. It's an iron chelating agent which chelate excessive iron in our body. Erythropoietin and other drugs are chloroquine. As I have already mentioned, low dose of anti-malarial drug chloroquine 125 milligram and 250 milligram twice weekly is a drug which used to treat Porphyria cutanea tarda. Thank you very much. Stay connected and subscribe my YouTube channel.